So we've already discussed foot surgeries. Let's talk about what we do with the shoeing. How is it different? So it's performed mainly for pricking or purulent inflammations of the corium and resection of the deep digital flexor tendon. So for those procedures, so just remember that sentence. And a horseshoe with a metal pad is used. And it's attached by replaceable studs so you can take them in and out. And a bandage with antiseptics is placed between the metal plates and the foot. So this is extirpation of the foot cartilage by a couple of methods. So when would we do this? It shows the indication here. It's for progressive necrosis of the hoof cartilage, so necrosis of, hear this, and formation of the fistula holes, so if there's actual infection leading to a hole. And when we do conservative treatment, it doesn't work for this case. So the methods are currently used and divided into three groups. So you have the first group, second, and third. So the first group aims to remove the hoof cartilage access over the coronal band using Sapochnikov's method or Povashenko. The second group is the keratogenic areas of the hoof are preserved. Yeah, so let's try and look at the pictures here because it's very confusing. So the first group aims, so this method and this method aims to remove the hoof cartilage by accessing over the coronal band, so above the hoof. The second group, so Zhikov's method. Okay, so basically these methods, just ignore this. I'm mainly looking at Zhikov's method. The keratogenic areas of the hoof are preserved. So the cartilage is removed after creating two accesses, so here and here. One above the hoof band and one below, and this is Zhikov's method through a small skin incision, and then you do trepanation of the hoof wall. And then the third group, so this involves a lot of methods, so methods of Bayer, Aberline isn't here, but I'll show the word to you. Zilper, Zipper-Schmidt, and Ivanov here. So let's focus on, actually Ivanov's also here, so just forget Mueller-Frick entirely for a minute. So just focus on these four. This is the third group. So the entire hoof cartilage is revealed after removal of part of the wall and the corium, and you can use basically any of these methods to do that. So the choice of one or another method depends on the location of the necrotic area, observing the principle of total cartilage removal. You should obviously pay attention to the undulate cartilage when dissecting its axial surface because of its close location to the posterior joint recess. So because basically you could penetrate the joint, which is very harmful. So Povashenko's method, what the hell is that? So Povashenko is, like I said, it's an incision above the coronal band in the area of the cartilage, and you have two incisions, so you've made like a V-shaped, and they're joined at an angle, and it's directed downwards to the middle of the cartilage, and the tip lies 1 to 2 centimeters above the band, so this distance is 1 to 2 centimeters, and in total extirpation of the cartilage, you have a cavity or pocket is formed, where the wound secretion or discharge is retained. To remove this pocket, you use a counter aperture opening, and it's made in the hoof wall. Oh, so this is the counter aperture opening. I'm sorry about that. With a diameter of 0.5 to 1 centimeters, and this hole is on the vertical line, drawn from the top of the incision and below the lower edge of the cartilage. Next, we have the Mueller-Frick's method. So now we're giving it attention. Yeah, and they're showing you what it would look like on an actual hoof. So if they show you this picture or this picture, that's what it's referring to. So the hoof wall under the coronary band is thinned with a spear knife. So you basically move it off layer by layer, and you can use a file about 5 centimeters wide. Then with a scalpel, you make a single incision through the horn and the corium, parallel to the coronal band, and reach the cartilage underneath. The rules are divided into a lunar section, so after your initial incision here, you'll do a lunar section, which starts from the front and ends at the back edge. This segment of the wall is removed, and the proper skin is then dissected from the cartilage, and the medial surface of the cartilage is prepared in another way, and what you get is the cartilage is released, and you get a dividing you do a dividing advanced incision into 2 equal parts, which is extubated one by one. And if you want to see what that looks like, it says dividing advanced incision into 2 equal parts, extubated one by one. Okay, so now it's talking about incisions on the hoof wall when ossifying the hoof cartilage. So this is different to before, so I'll try and focus here. We mentioned Aberline briefly, but we'll go into everything. So the Aberline method, basically the horn wall under the ossified cartilage is sharpened strongly with a hoof knife, and then you do a semi-lunar groove like this, and it's made on the white lamellar horn deeply, and then you do and this is done 2 centimeters below the coronary band. Then you have the Mesler method. So you make 3 perpendicular grooves to the lamellar horn of the wall, reaching the edge of the foot, and there are 2 centimeters from the coronary band. Bless me. Schmidt's method. So Schmidt's method is similar to Mesler's, but it differs from it in that its end grooves are joined by a cross section lying in the white line of the hoof edge, and the posterior groove is parallel to the heel line. Then you have the Gross method. So on the wall with a hoof knife, you make an annular groove on the lamellar horn, and it's 1 centimeter wide. It's located 2 centimeters below and parallel to the coronary band. So the coronary band, whenever they refer to it, it's like the line that lines the top of the hoof itself. Oh, okay, so yeah, I'm on the next slide now. So yeah, you have incisions on the hoof wall. Yeah, so it's the same topic. So it's just going through more methods now. So Garanov's method, like our professor. So it's the Schmidt and Gross methods combined. And after you make the incisions in the wall, the hoof is trimmed properly. I'll show it to you like this. Protecting the foot and the heels, and you basically add a slipper extension horseshoe with thicker branches, so that it's thicker here and here, and a closed horseshoe with a leather pad used. So basically, you know how you have a horseshoe that's only a U shape, this is going to be a full circle, and you'll have a leather pad towards the heel. And yeah, it just shows different degrees of ossification of hoof cartilages and why it's so important to look after them. So surgery in hoof wall cracks. So what is a hoof wall crack? It's a violation of the integrity of the hoof wall. They can be transverse, they can be transverse that way, they can be longitudinal. By location, they can be either, I'll show you the words, engaged, lateral, heel, and in length, they can be coronary. So I would say from the coronary band, in the distal part, so in the foot, continuous from the coronary to the edge of the foot, so coronary foot, and according to the depth, so it can be superficial, deep, according to and penetrating or reaching the corium. So the corium, as we said, is the layer underneath, and the causes of cracks are usually just poor environmental conditions, nutrition, poor and improper care of hooves, injuries, and others. And there are different types of transverse cracks here. You can see this is much deeper, probably going into the corium. Okay, so I think I'll talk about the treatment here and then we'll stop for a bit. So the treatment of horn cracks is by orthopedic shoeing. So you can see we have tongues here with a closed horseshoe. So just imagine the horseshoe goes all the way transversely along the heel. And yeah, you fill the crack with, for example, polymethyl methacrylate acrylic, so let me show it to you, PMMA, or polyurethanes after proper treatment of the horn crack, and so yeah, this is it filled now, and you can heal the crack by thinning the horn wall or by grooves with a suitable direction. So we'll stop here.